Hi! In this lesson, I'll go over one of the essential concepts facilitating access for babies, toddlers, and caregivers, the 15-minute neighborhoods. It is a main recommendation in the Access for All report outlining 5 key components. In this lesson, we are going to be talking about the 15-minute neighborhoods and their key elements that make healthy, engaging, and accessible places to thrive for small kids and their families. We will begin by unpacking a bit more what we learned in the previous module, and then we will bring everything back together as we talk about how to think about 15-minute neighborhoods, especially from this perspective of the needs of growing babies, toddlers, and their caregivers. In the previous module, we spoke about the framework for land use and the framework for mobility, and we saw how these two pieces are foundational to have good access. So let's keep that in mind as we move forward. Very quick reminder here from before, and the second thing to keep in mind is that access is grounded in walking, as it is the easiest and most convenient mobility option for caregivers. For them, walking trips are easy to plan for, and they provide opportunities for interactions and brain stimulation for the baby. But having walking as the main mode of transport for caregivers is of course ideal. We have to think about walking for who and walking how, because walking is affected by urban conditions, as you may remember from previous module. And it also depends on the physical ability of the person walking, whether that person is limited physically in some way or is experiencing encumbered travel with goods or small children. So why are we talking about a 15-minute access? Actually, 15 to 20 minutes is the time that a person is willing to comfortably commute to get to essential daily needs, such as to take a child to a school or go grocery shopping or go to a local playground and so on. This may also include cycling. A 15-minute cycle ride is actually convenient and can give you a greater reach to diversity of services and places. So based on this understanding, a 15-minute time might translate to different distances for different types of users. So in this diagram, you can see that an able-bodied person who is not encumbered by care duties, essentially whose trips are not related to mobility of care, that person can walk as much as 4 times further than a caregiver who walks slowly and stops often with a toddler. So when we think about 15-minute neighborhoods, we really have to account for the slow-moving walkers, which is something that cities typically do not do. Urban characteristics like the street network influence how far you can go. When you have disconnected streets, such as the ones in the circle on the left, you have a limited access. But the circle on the right shows a more dense and a continuous street network that gives you a more extensive reach. Similar to that are the street conditions, whether they actually encourage or discourage walking. So on the left, you see examples of obstructed walkway or long blocks with no activity in the ground floor or shade, important for a comfortable and convenient journey. And on the right, you see much nicer walking conditions, safe streets with short blocks and active street frontages. Also, just to recap, local destinations are what caregivers need to help them fulfill their daily caregiving trips within a short time, and they're instrumental for 15-minute neighborhoods. So in this diagram, you see the types of destinations on the left and how frequently caregivers need to reach them, indicated by a dot. What this tells us is that the location of these destinations where caregivers go daily, or even sometimes several times a day, should be as close to home as possible to facilitate these daily trips. Additionally, what is plotted in this diagram are the modes of transport that can facilitate the different trips. Multiplicity of modes actually supports 15-minute access, with walking accommodating the close-by trips, cycling facilitating the medium trips, and frequent public transport facilitating medium to longer trips, or also trips that are not really walkable. So now going back to defining 15-minute neighborhoods and bringing everything together. 15-minute neighborhoods are a way of thinking about how cities should be planned. They're not self-contained enclaves, but rather they are the recipe for an easy and convenient access where the daily needs can be reached within those 15 minutes with sustainable transport modes, preferably by walking. They are also healthy and stimulating places because they are grounded in walkability and proximity to vibrant city activities. Here they are, the 5 key ingredients that establish the 15-minute neighborhoods. So we have the basic infrastructure, local mobility, destinations, environment, and play. The first 3, the basic infrastructure, local mobility, and destinations are the foundation of enabling access. But we have to also look at the role of cities holistically, because cities are not only about hard infrastructure like buildings, streets, or infrastructure. For babies and toddlers, as well as everyone else in the city, like the elderly, youth, a healthy, safe, and engaging public realm is as important. So that's why we also have local healthy environment and local play in the list of ingredients. Well-functioning neighborhoods need basic infrastructure, including dedicated space for connected street networks, street drainage, sewage, water supply, as well as the public transport service for a functioning urban settlement. Streets should actually occupy about 25 to 30% of city space, and they should be planned as complete networks. These are often overlooked but are crucial elements in low-income countries where many neighborhoods develop organically without this foundation. They need actually a lot of retrofit measures. So in the picture, you can see Urban Village in Jakarta, which is a type of semi-formal or urban settlement, where the designated local streets allow for mobility and running the basic infrastructure. And there are also larger streets, not pictured here, that allow running public transport on them. Following that, we have good local mobility, which aims at enabling walking and cycling as the main transport modes. So walkable access is the ideal, but that requires short distances to reach services in a reasonable time. And many areas are far from that ideal. Cycling and public transport can expand access to 5 or even 10-fold. The reason why 15-minute neighborhoods should provide multiplicity of modes is that not all places have those good walking conditions. So they should provide access to other forms of public frequent transport that will take you to the destinations that you need to go in 15 minutes. So here, the important things are provision of various modes of transport and also ensuring that the streets are designed for safe travel on foot. On the bike, of course, we need sidewalks that allow safe walking with strollers, safe crosswalks, and wide and protected cycle lanes. Streets need to also have places to rest with seating, shade, and other amenities to help caregivers move around with their babies and toddlers, like in the picture from Sao Paulo. And these types of street design interventions are relatively cheap and fast to implement, and they make a huge difference in making the journeys more comfortable for the kids and people who care for them. And lastly, public realm encourages the 15-minute access when street frontages are active and vibrant, so that they increase sense of personal security with more eyes on the street, and they also encourage that interaction with the inside uses and activity. The following lesson in this module actually dives deeper into the local mobility conditions. Objective of this next ingredient is to ensure the key caregiving destinations are within walking or cycling distance for households. And local destinations are about land use planning, meaning how the residential uses are matched with commercial, institutional, and recreational activities. We found out from the walk and frequency analyses before that priority services like daycares, playgrounds, grocery stores should be located as close to home as possible, since they are so essential to families. This can happen through mixed land use planning, but also clustering and co-locating services to reduce the trips for caregivers. You can see examples of both here from Tirana, with commercial activity on the bottom floor of the mixed-use buildings, and also a local facility in one of the residential developments that has a healthcare clinic and a library in the same building. Informal vending and pop-ups also support access to local destinations. Many cities actually recognize a vital role of informal vending in providing fresh food to people and also creating employment options. And they allocate spaces for these types of activities. But besides creating destinations, it is also about bringing people closer to them, especially people of different income backgrounds who need the services and opportunities locally. Many poor households in the Global South may live on the city peripheries and simply do not have means to access frequent and reliable public transport and the services important to their babies and toddlers. So the objective of the local destinations is also about providing a mix of housing for all types of households, which can happen through inclusive housing policy. Then it is also important to think about retaining the existing people locally while helping the low-income neighborhoods improve their conditions, provide better housing, and improve streets and services. So you can see examples of both. The picture on the left is from a Melrose community in New York City, where low-income housing provisions were embedded in the local development plan. And on the right, you see a picture from Yerwada community in Pune, where equitable upgrade process help residents retain their homes while improving housing conditions and the infrastructure. Then we have local play promoting engaging environments, equally important ingredient of 15-minute neighborhoods. Since young children learn through play, having diverse and frequent open spaces, greenery, and play street is instrumental to healthy cognitive and physical growth. These elements also can be beneficial to other people of all ages and can easily be programmed together. So streets, public spaces, transport stops, neighborhood facilities can include creative play elements, such as the one you see from Pune with a play facility within the pedestrian zone, or the picture from Sao Paulo showing interactive elements and colors. Street and public space can also help caregivers engage the child in physical activity, exploration, and learning through programs. Programs for families and tactical urbanism can help caregivers take advantage of their city and have more access to outdoor activity. And the last key ingredient is the local environment. Safe, calm, and healthy local environment is extremely important to the well-being of babies and toddlers. Having a healthy environment where children's growth is not aggravated by air and noise pollution is also beneficial to everyone. To improve local environment, you need to look at the street design and open space. You can do things like slow speed zones, traffic calming measures, and reduce parking that lessen that interaction with vehicles and improve air quality where kids live. You can also add soft infrastructure like greenery and green buffers within the street space or in areas that are sort of underutilized. These are relatively easy tactics that do not require long-term implementation, but create immense benefits for the residents. These key elements we just went over can form the basis of policies, design guidelines, and urban plans. But in a nutshell, there is no one-size-fits-all approach to creating 15-minute neighborhoods because simply of the nature of our cities and different levels of urban development. The processes of achieving 15-minute neighborhoods will actually vary for different places. For example, if you want to retrofit an existing neighborhood to be healthier, more accessible, and vibrant, you can start by implementing low-cost, high-impact interventions that improve street safety and reduce air pollution. And you can see an example of that from Udaipur, where Plaza Intervention closed the street to traffic and parking and added this beautiful interactive element. You can also improve pedestrian and cycling infrastructure, and you can add interventions that can create more enjoyable and convenient journeys for the caregivers. In the next module, we'll actually dive deeper into the solutions, looking at other contributing strategies like the role of governments and the short to long-term solutions. Also, cities can use tools to help plan and measure 15-minute access and the conditions of urban environment to see gaps and how you can improve them. For example, Pedestrians First measures people's proximity to everyday needs like open space, healthcare, education, and public transport. Here's the example of Nashik in India and the overlay of the population density with area where people have access to basic services. And actually, the yellow circles show the absence of services despite that the areas are densely populated. Cities can use tools like these to see where the gaps in coverage may be. Then we also have accessibility tools that many cities have been using to help them plan land use and transportation. Like this one from ITDP Mexico, which measures, in the example shown, the reach from a point by cycling to city opportunities within 30 minutes. So what tools like this one can detect is how well the pedestrian or cycle networks are developed. It can also show coverage and frequency of public transport and how many destinations you can reach in a given time. You can, of course, adjust tools like these to the speed you need, for example, to the speed of caregivers, and then really see the accessibility gaps. With that, I hope you'll read more about the 15-minute neighborhoods in the report and also download the infographic at the link in the screen. And I will see you at the next lesson.